recently, New England Journal of Medicine, prestigious journal, published the results of so-called atresia study. This study was also performed in our department, and I had the honor to be a member of steering committee of this study. And what was this study about? The study recruited patients with so-called subclinical atrial fibrillation. It means the fibrillation that they never did know that they have this arrhythmia, and was only detected by devices like a pacemaker or implantable cardioverter defibrillator. And duration of this arrhythmia was from 6 minutes up to 24 hours. And until now, we had no clue whether we should give these patients anticoagulation treatment, although some preliminary data suggested that we should do that. And this study randomized patients to treatment with apixaban, which is a novel anticoagulant drug, twice 5 milligrams a day, versus aspirin 81 milligram per day. And the results of this study, with a quite long follow-up, more than 3.5 years, showed clearly that there is a significant reduction of thromboembolic events in this treatment group with apixaban, more than 37 in reality percent reduction, and fatal thromboembolic events were reduced by 49%. On the other hand, the study showed that there is some increase of bleeding, a risk of bleeding 1.7 versus 0.94, which was more or less not so, let's say, significant in a way that most of these bleeding events were treated conservatively or with supportive therapy. And there were no differences in fatalities in bleeding between both groups. So this study first time showed us clearly that we should give these patients anticoagulation treatment, and that's an important piece of knowledge.